Hello there, my name is Joanne Duncan and I am a Safe Staffing Advisor with the Care Inspectorate supporting the daycare of children and childminding services. This evening we have just finished our third childminding webinar, so thank you to everyone who joined me this evening. During the webinar I showed a video on the screen and unfortunately the recording didn't pick up the video, so I'm re-recording this just so that it's available on the Hub page. Tonight's session was a Q&A session and provided opportunities to ask questions or seek clarification about anything that we've covered over the previous two sessions. Thank you again to everyone who submitted their questions in advance. That has allowed me to group the questions that were asked in order to provide a response to anyone who didn't want to come into the meeting, come off mic, or who couldn't attend tonight's session, so that they were able to view the response on the recording. I then opened up the session to questions and I will repeat the question that was asked during the live session so that that's available in the recording. So I'll move on to displaying the first questions. Now, we received questions on the screen that we've grouped together to answer in respect of paperwork that will be required to evidence this act, with some questions related to how much paperwork is required. Now, in terms of producing evidence, we will continue to be proportionate with our evidence requests and reviews. Again, any evidence requested should be to add to our assessment of the outcomes for children. So this will include discussions with yourself or your assistants if applicable, and include reviewing certain paperwork. Now, any paperwork you keep or information that you gather should be done so in order to support improved outcomes for children using your service, and in some cases to meet current legislative requirements. When I talk about meeting current requirements, one example would be children's personal plans. So there's already legislation in place that states that children must have a personal plan in place within 28 days of registering with your service. Other paperwork mentioned in the question, such as how you plan or train, is not mandatory, but if it's used well, it can really promote improved outcomes. The benefits of keeping plans or training is really well documented because this allows you to reflect on plans and identify any areas for improvement, which is the key to self-evaluating your service. Now, how you work will be defined in your statement of aims and objectives and your service policies and procedures. And these are important because they lay out how you will run your service and promotes consistency of expectation between yourself and parents or carers. Up-to-date record keeping is a really important element of childminding and running your own care service. But record keeping should be kept manageable so that it doesn't take up too much time away from the care of children. There are certain changes that you have to keep us informed about and annual forms that you need to complete. So including these in your quality assurance processes will ensure that you're meeting the requirements set out when your service was registered. There won't be any additional expectations of current standards or guidelines in order to evidence this act, because we've identified throughout this webinar series that you're already evidencing how children's views are being taken into account in your current self-evaluation processes or improvement plans. There will be an expectation that you are aware of the new legislation, as this is what your registration is based on and legislation that underpins your practice, but you can find ways of including this within your current processes. When you're reviewing your self-evaluation processes or your improvement plans, highlight areas that the new legislation covers. So if your policies or procedures indicate perhaps specific health and social care standards that they relate to, you could perhaps record which of the main principles this policy relates to. And this would evidence your knowledge and understanding of the Act and incorporate that into your current processes. Now, these questions were related to training and qualifications. Now, as mentioned, there will be an expectation that childminders are aware of the new legislation and that you've considered what it means for you. This does call for a certain level of professional development, but as highlighted during the first webinar, when considering qualifications, this doesn't just cover formal qualifications. This should consider skills, knowledge and values, and individuals' suitability to provide high quality care based on best practice. So when we ask for awareness of the Act, that won't come through formal routes or requesting updated qualifications. This will be about finding ways to upskill yourself about the Act, and one way of doing that is by attending and contributing to this webinar series, or by viewing the content available on the Hub page. Now, someone's mentioned the training available on TURAS, which is the Modules for the Knowledge and Skills Framework. Now, this framework was developed by Healthcare Improvement Scotland and NHS Education Scotland, and it was to support all services across the health and care sector to provide a consistent and inclusive approach to learning and development and the application of this legislation. The team who were developing the resource held consultations in November, and the message from the social care sector, including childminders who were really well represented, was that the resource was too health focused and didn't offer a positive learning experience for social care workers. We expected the review of this framework to have been completed, which is why we included questions in the annual return specifically relating to this framework. Now, if you've already completed the modules and found it useful, then that's great. However, there won't be an expectation to complete the modules that are currently available on the TURAS site. As with any learning and development, it should be done in order to promote reflective practice and service improvement. So it's really important that you find ways of developing your knowledge about the Act in a way that's meaningful to you and your service. In terms of how we will move forward when the legislation is enacted, this will look the same as how we currently use other legislation for regulatory purposes. Every registered care service must continuously meet the requirements of a number of acts of legislation, including the Public Services Reform Scotland Act and the Social Care and Social Work Improvement Scotland Regulations 2011, which you may know as the Scottish Statutory Instruments, or the SSIs. Now, legislation underpins your practice and sets out requirements that service providers must follow. Our quality frameworks have been developed to support services to self-evaluate their settings, and inspectors then use these quality frameworks to provide assurance about the quality of care and support. Now, the quality framework allows for that shared understanding of what constitutes good care and learning, and supports transparency in the inspection process. So the quality framework will remain in place and will continue to be used during inspections. And this legislation is what underpins your practice and states areas that you must consider when delivering your service to ensure that you're providing safe and high quality services and ensuring the best care outcomes for children. There's a question there about cross-referencing, and we have cross-referenced each of the main principles and the information regarding areas that you may consider from the Health and Social Care Standards and the Quality Framework, and these were shared during the second webinar last week. The recording, which does contain all of the great practice examples from childminders who attended, is available on the Hub page along with the slides used. And I'll show you the video in a second of how you can access these and other resources available to support you to prepare for the enactment in April, and following that date to support with embedding the principles in your practice. Now, I'm sorry to read that someone felt overwhelmed with the information provided during the second webinar, and that was not our intention. We mentioned during the webinar that this legislation was not seeking anything new or innovative. The change that the Health and Care Staffing Scotland Act does bring is a legal underpinning and a higher profile to what was previously considered best practice. So if you already do everything in your service that's been covered, then that's great, that's fantastic, and you'll be well on your way to already meeting the requirements of this legislation. And if you did contribute to those discussions and interactive elements, then thank you very much for sharing your good practice with your other childminding colleagues, because I'm sure there were people on the call or people who are watching the recording who will benefit from the ideas of practice that you shared during these sessions. So thanks very much for that. Now, on the next screen, I have a recording of our Hub page, and I'll show you the resources that are available and where you can find the recording for the webinars. So you can see here our Safe Staffing Hub page. If you just Google Safe Staffing Care Inspectorate, scroll down to the bottom and click on the pink and purple poster for ELC services. Now you'll see the poster on the left-hand side here of the screen, and this is being made available, which describes the purpose of the Act, and it gives you the 8 main principles from the Act, written in language that you can understand what this means in practice. So it's not the wording from the legislation, it's a sentence which summarises the main principle. And that can be downloaded from the Hub page by pressing that green button. Now you can see a section here for childminding, so if you open that, the first video that you can play is a bite-sized video. This is 6 minutes long and it supports you to understand the first part of the Act, part 1, and there's a little bit of explanation there about part 1. You can see here the 8 main principles from part 1, and these are all hyperlinked. Now if you open the hyperlink, this takes you to a paragraph that's been taken from the statutory guidance that was written by the Scottish Ministers that we spoke about in the first webinar. And there's some documents that you may consider on the right hand side, and this is for every one of the 8 main principles. All of these PDF pop-outs are different and they are related to the 8 main principles. This second bite-sized video is another really short video and talks about part 3 of the Act. Now again, it's only part 1 and part 3 of the legislation that is applicable for childminding services. And there's some information there that I'm showing you about the statutory guidance, again, that's been written by the Scottish Ministers, with some more documents that you may consider for part 3 of the Act. Now you'll see here the webinar section, and this is where we have all of the recordings from the webinar series that we've held. So the first webinar on the 17th of January, we provided an overview of the Act and we looked at Principles 1 and Principles 5 from part 1. And the second webinar we spoke about the remaining principles. So you'll see there I clicked on presentation slides, and those are the slides that were used during the webinars. So if you scroll down to the purpley slide, and this is where we have created those links to the health and social care standards and the quality framework. Now these are suggested links. You may have other health and social care standards that you feel are relevant to each of the main principles. So there are links to the health and social care standards and the quality framework for each of the 8 main principles. Again, you'll find Principle 1 and 5 in Webinar 1 and the remaining 6 in Webinar 2. The last piece I wanted to show you from the Hub page was the Useful Links section, which shows you the link for the legislation in its entirety if you wanted to go and read that, and the statutory guidance that we have taken information from to support with your knowledge and understanding of the 8 main principles. So I hope that was helpful to just show you how to access that. Now that brought us to the end of the questions that were submitted, and thank you everybody again who submitted their questions and sent those in. I then opened the session to a Q&A session, and we had one question which was asked by somebody from the Scottish Childminding Association who were here to represent one of their members, so thank you to the SCMA for supporting this event. The question was around accessing the information that was shared by childminders during the first 2 webinar series, when everybody contributed their ideas using the AHA slides when they popped up on the screen in the different coloured boxes. Somebody was asking if they were available to view, and they are available to view in the recordings, and you can access those in the Hub page that I've just showed you. And if you click on the 2 webinar recordings for the first 2 and watch those recordings, that's where you'll see everybody's contribution from those evenings, and there are some great contributions there, so please do watch these. So thank you for listening to this 3rd webinar. I hope the series has been helpful. On the screen here was a QR code directly to our Hub page, so hopefully you can scan that with your phone and that gives you quick and easy access to the Hub page. You'll see here on the screen our programme email address, so if anybody does have any other questions once you've had a chance to reflect and review all of the information on our Hub page, then please do submit your questions to the email address, and we'll do our best to support you as much as we can. So thanks very much everyone.